Hi, I'm Dr. Piazza. Today I'm explaining kind of the quick facts about breast augmentation and how we look at sizing an implant for a patient. I think the best way to start, and I've got some notes here, is cup size as a guide. We always ask our patients, what is your current cup size and what is your desired cup size? Now, this isn't set in stone. It doesn't mean we can create automatically a C or a D cup because most bra manufacturers make lots of different sizes of bras, and you can't really compare one manufacturer to the next. So we use it as a guide to understand how big is a patient looking to enhance their breast. So then when we look at, after we've asked that question and accomplished that goal, we now want to look at the upper pole fullness. So if we're looking at a breast from a side profile here, and if this is the abdomen down below and we have a nipple and areola that's out in the most projecting portion of the breast, we want to look at what's called the upper pole of the breast, and that is this area right here, okay? Now, after pregnancy or after weight loss, we see lots of loss of volume in this portion of the breast and the entire breast in general, and have almost a droopy appearance to the breast. And most women who seek breast augmentation want to enhance the contour of the upper portion of their breast. So that is, again, in this area here, increasing the amount of volume in this area and increasing the size of the breast altogether. Again, desired upper pole fullness. How much upper pole fullness does a patient want? When we're looking at position of the nipple, we actually want to look at position of the nipple and have that nipple at the most projecting portion of the breast. A lot of times by doing a straightforward augmentation, we can actually increase or elevate that nipple's position into a proper position. But sometimes, if the nipple is low in comparison to the breast fold, the patient may need a breast lift. Now, if you look at this diagram, you can see that we have all of these things have been pointed out. 1, 2, and 3. Where's the position of the nipple? What is the desired upper pole fullness? And we are using cup size as a guide. Now, one of the most important measurements that we take in an exam for breast augmentation is we're actually looking at the what's called breast width. Okay? So if this is a patient and we're looking at the right breast, and we have a nipple and areola present here, and we're actually looking at what is the width of this breast. And we use that width to determine what the right footprint is of our breast implant. So if you think about a breast being similar to a shoe, and you're thinking about an implant being similar to a foot, you want to fit the right foot and shoe together. So we don't want an implant that is too wide, and we don't want an implant that's too narrow. We want an implant that fits this actual width right here, and that's how we choose what the right size implant is for a given breast. From there, we can increase volumes in order to achieve the fullness that a patient desires. And lastly, is a lift needed? Again, like we talked about a second ago, if the nipple position is low in comparison to the breast fold, the patient may need some excess skin removed from the breast in order to lift the nipple and areola complex. Now, I will tell you, it doesn't mean we're removing the nipple at all. We're just removing some skin around it. I hope this has been informative with regards to breast augmentation. It really is actually a very straightforward process. There are a number of different variables that come into play. And let me know if you have any questions.